When I originally started doing this work, it was all about domestic violence. That was it. That's the population I wanted to serve. You can't work with victims of domestic violence without talking to victims of sexual assault. You know, that comes with it. And then you've got the child abuse. And then you realize that there are women being trafficked or kids being trafficked. At some point in time, I realized that the #1 cause of homelessness for women was domestic violence. So in order to really fix the domestic violence piece, we needed to get homeless women off the street. So then I became an advocate for the homeless. And then as I came here to Woodland, advocacy for undocumented immigrants. So there's just such a great need for so many things. It just keeps building. It's all interrelated. And now when I think about it, I don't think I could work with a domestic violence victim if I couldn't offer them all of these other services, because I think it's really important. Probably the biggest thing we do is connect people to the right resources. So people come here a lot who don't know what they need, they just know they need some help. The partnership with Dignity Health is really important. #1, again, it goes back to that connecting people to the resources that they need, but it's also about supporting people as they go through the systems in order to get the right health care. So that connection is really good. We can get our people to Dignity Health if they need it, or Dignity Health can get their people over to us if they need help.
The role of a patient navigator is to help patients that go to the ER. We connect them with the primary care and we schedule follow-up appointments.
The great thing about the patient navigators is that they can help people, connect people to the right doctors, the right clinics. So now we've helped you with the insurance piece of it. So now that you have that, you don't need to come to the emergency room anymore. You can go to the right doctor who can give you the specific service that you need. And that's where you should go anyway, right?
My name is Nancy Gonzalez, and my role is a patient navigator. So I met this client at the ER, and
Pues esa vez que me llevaron en urgencia fue porque yo iba a la clínica y de aquí iba 2 cuadras para allá cuando me pegó el mal y pues yo, lo que se me vino a mi mente, yo decía, ¿qué estoy haciendo aquí? ¿Por qué estoy aquí?
¿No se acordaba?
No, es que yo nunca me acuerdo de nada, todo se me olvida, no sé lo que hago. Ya me han dicho que cuando me pega me duermo un rato, ya me acuerdo bien. Si no duermo, se me olvida todo, no me acuerdo. Porque en estas cosas que yo tengo, se te olvida todo y hay veces que hasta el diablo se te mete y quieres hacer cosas que no debes. Por eso le pido a Dios que se me quite esto.
I was able to be there with her. I told the doctor and the nurse that she tends to forget about things. So I was able to be with her and support her with the information the doctor was given.
¿Cómo le ha ayudado Nancy desde la vez que la miró usted en emergencia?
Pues me ha ayudado mucho en cosas que he ocupado, que uno a veces que se quiere deshogar, les cuento. Ahí se le olvidan las cosas a uno, ya sale cosa bien. Pues ya le dije que ahí me siento feliz porque ya sé a quién hablarle. No voy a batallar.
You know, you come in and you say, I don't have any insurance, and they might say to you, if you don't have insurance, maybe do you also need food? Do you also need shelter? Do you also need anything else? I ran into a gal and she said, I went out to the hospital, I needed to get health care, but I didn't have insurance, and someone connected me with Elizabeth, and she said, Elizabeth sat there and said, we're gonna figure this out. And she said, by the time I left, we'd figured out so many things, you know? It's just great. It's great to it's not just about insurance. It's not just about the service you get at the hospital. It really is about connections to the community. So I love that about Dignity Health. It really does help us help people do more, and that's what we're all really about. And I think that that's probably the most important thing about our partnership is that everyone can get health care. Where we come together, no one's left out.